Thank you for the opportunity to present findings from our study. My name is Oluwasegun Maki. We have no disclosures. Prostate cancer is one of the commonest malignancies among American men, and it's also the second leading cause of cancer-specific mortality in these men. And usually it occurs among older men with an average age of 66 years. The natural history of this disease has been understudied among young men in the United States. The objective of the present study is to determine the profile and also outcomes of patients who develop prostate cancer age 50 and below. And to do this, we actually conducted a retrospective analysis using the National Cancer Database spanning from January 2004 to December 2018. We compared overall survival between young patients who were defined as patients whose age at diagnosis was 50 or below, and a control group of patients with prostate cancer whose age were above the age of 50. Here at the inception of the study, we have about 840,000 patients with primary prostate malignancies, and about 6.3% of these patients, that's translated to about 52,000, were diagnosed at the age of 50 or below. Looking at this table, you see black patients are represented by the red, while the white patients are represented by the blue. And overall, in the total population, we have about 81.3% of whites, while there were about 14.2% of blacks. But when we focus at men who were diagnosed at the age of 50 or below, we found out that 21% of these patients were blacks, showing an overrepresentation of blacks in this particular age group. We went ahead to conduct a corpse regression where we tried to determine the factors that are associated with survival among the whole group. And we adjusted the model for the disease stage representation. We adjusted for social determinant of health, such as patient education level, insurance type, and income. And we adjusted for pre-existing comorbidities using the Charlson Comorbidity Index and treatment modality. In this analysis, our reference group are white patients, black patients who are below who are diagnosed at the age of 50 or below, and that is represented by the vertical green line. If you look at this, when we compare black patients who are diagnosed at the age of 50 and at age that is greater than 50 to the reference point, we found out that outcomes, the survival is worse with black patients diagnosed after the age of 50. We can also say this for whites who are diagnosed at the age greater than 50 also has a worse outcome when compared to our reference group. However, when we compare black patients diagnosed at the age of 50 or below and white patients diagnosed at the age of 50 or below, there was no difference in the survival, showing that there is no race disparity among patients with prostate cancer when diagnosed at the age of 50 or below. In conclusion, patients with prostate cancer age 50 and below have better overall survival when compared to their older counterparts. And black patients are overrepresented among young prostate cancer patients. And this may be a point that can be used to benefit. This particular group of patients may benefit from an earlier screening. Thank you. I'll be happy to answer your questions.
Good morning, Jim Galantla from UT Knoxville. And thank you for this talk. This is an area that I think raises a lot of questions, just regardless of what you manage in surgery, figuring out how to interpret prostate cancer and what it means long-term is really a daily challenge. Through the NCDB, are you able to discern down to the Gleason score? Does that, I don't know the database that well enough to know. Okay, often if it's when we have urologists at tumor conference, a low Gleason score, we tend to prioritize whatever other malignancy we're dealing with. But how did that impact the interpretation of your results of this?
Yeah, thank you for the question. We actually, in the National Cancer Database, we are able to account for the Gleason score, and we actually accounted for this in our analysis. We use both the disease staging, we use the Gleason score, and we use the prostate PSA value. And even after we included this in our models, that was when we got this result that we found. So we accounted for those very important variables.
Very good talk. Thank you. We'll move on to the